The Zika virus may seem to be a world away, but with recent cases appearing across the United States, this not-so-new virus is grabbing the attention of the media and medical professionals alike. With the upcoming Summer Olympics scheduled to take place in Brazil, the epicenter of the recent Zika outbreak, concern is growing over the threat the virus may pose, particularly to pregnant women. New York is far from Brazil, but many in our area have questions and concerns. The Zika virus is not new.
Zika virus is not a new virus. It actually has been around for almost 70 years and was first seen in the Zika forest of Uganda in 1947. So what we are now seeing is that the same mosquitoes that carry the dengue and chikungunya virus are now also carrying the Zika virus.
Since Zika had not been seen in this part of the world prior to the recent outbreak, few are immune to it. This lack of immunity, combined with environmental factors that caused an increase in the mosquito population, led to the spread of Zika.
With the Zika virus, the mosquitoes that tend to carry this particular virus, they like to be contained and populate in small containers. Unfortunately, Brazil went through a major drought. So when droughts occur, what do? People end up collecting water in small containers. That's why we had such an explosion of this virus take place in Brazil.
Fortunately, most people who do contract the Zika virus will never become ill, and most of those who do will experience mild symptoms.
The infection rate for the Zika virus is actually 73%. So 3 out of 4 people will possibly contract the Zika virus after being bit by this particular mosquito. But among those 73%, only 18% will actually have signs and symptoms. That means everyone else who's been bitten by this mosquito is not going to be showing signs of being sick. What we are looking for are the signs and symptoms of a fever, a rash, conjunctivitis, or reddened eyes without a discharge, and joint pain.
Based on a growing body of preliminary research, there is scientific consensus that Zika virus is a cause of microcephaly and Guillain-Barré syndrome, the development of unusually small heads and brain damage in newborns, which puts pregnant women at risk. Because of this, both the Centers for Disease Control and the World Health Organization have issued warnings for pregnant women to avoid areas where Zika is prevalent.
With the increases of microcephaly, we have strong evidence that does point towards the direction of it being related to the Zika virus.
Recently, investigators announced for the first time that they have identified a case of sexually transmitted Zika virus in a person who did not visit a country where Zika is prevalent. This development has led the Centers for Disease Control to issue guidelines suggesting pregnant women avoid sexual contact with men who have returned from these areas. And there are other warnings for women planning to become pregnant.
So women who have traveled to an area with an ongoing Zika virus transmission should wait a minimum of 21 days after returning home before trying to get pregnant. The 21 days is going to allow for an incubation period of 3 to 12 days plus approximately 7 days for the virus to clear the body.
Unfortunately, there is no widely available test for a Zika infection due to its mild symptoms.
There is no vaccine for this particular virus. There is no medicine to treat this particular virus. What doctors and nurses will do for patients that do have the Zika virus is basically management of the symptoms, hydration, management of the fever, comfort care, lots of rest.
As with many health concerns, prevention is often the best medicine.
There are going to be situations when people cannot avoid traveling to these areas. When that happens, there are some very strict recommendations sent by the CDC to help protect yourself from mosquito bites. That's going to be including wearing long sleeve shirts, wearing long pants, sleeping in a screened or air-conditioned room. We want to make sure that you're using an EPA certified bug repellent.
The recent outbreak has led some local hospitals and physicians to screen incoming patients for the Zika virus, especially those who have traveled abroad, by asking questions related to travel and symptoms they may be experiencing. Since this is an evolving situation, regular updates are being issued by the State Health Department, the CDC, and the World Health Organization.
We can expect to see new diseases pop up in places they hadn't been before. What we do expect people to do is really talk to their doctors, have a very good healthcare plan in place, and to really listen to the CDC and local health departments for the best advice and accurate information on how to prevent these diseases from occurring in their own area and how to protect themselves and their family.